Hi guys, I'm back. Diary of the Griever named John Weaver, which is me. It's 6:08 at night. It's still Wednesday, and I just came back home. I have been on a tirade regarding how much I don't like the medical establishment and kept on them like crazy. And kept being a smart ass and a smart aleck about the situation, smarmy in the mouth regarding them. But the thing of it is, the older I get, the more I need these guys to keep my mortal corpse working. And there's a good number of people working in the industry in various places that actually do take care of people left and right. I'm just trying to get some stuff worked around here. A friend of mine who works in this place, he did a very good job of taking care of my mama dog. Let me tell you what happened, guys. I had neglected my feet for a long while. Sorry, I'm just trying to get things together here. I neglected my feet, my body for a long while, and developed type 2. It's taken a while for my body to tell me these signs, even though I laughed at them, and wasn't a joke. I still had some kind of thing going on against the medical establishment. But it almost costed me my life. Said almost, but close to it. My family line has type 2 running through it. Thank God we're not type 1s. I don't think I could deal with the needles all my life. But type 2 is something developed either early or later on, depending on how screwed up one can treat the body. Mine was within a couple of years, or a little longer, earlier than that, I guess. And it was just very nasty. Very nasty. My brother died from it, my mother died from it, my grandmother died from it, my aunt died from it, one way or another, but my aunt had a heart condition. My grandmother had a stroke. My mother had many strokes, but died of respiratory failure. And my brother, trans-ischemic attacks, respiratory issues. And he smoked as well. And he drank cokes like crazy. All of them I saw died from the complications of diabetes because we have that in the family. Mine was developing neuropathy in both hands and feet because I wasn't taking care of my body enough or at all, such as, well, bathing works and keeping the feet clean. Also taking care of the damn nails. I have turned myself into a nightmare for myself. I've had pain in my foot for a few months. I didn't really realize that this was going to be, I really didn't take it seriously enough that I was going to be needing to get the doctors on my ass on this one. I didn't take it seriously enough, and those who have gone through this or new people that are going through this, well, I've been warned so many times. I didn't think it was really going to happen to me. It did. So, before Christmas, or even before Christmas Eve, I still had the shooting pains going through the feet. However, I didn't look at the condition of my foot. Not until after Christmas. When I started looking at it, it scared the hell out of me, especially when I started getting pus. For a couple of weeks. For a few weeks anyway. And it was degenerating into something nasty. Very nasty. I had to get an appointment with a doctor. So I was going to do an urgent care, but I scheduled a doctor's appointment. And then we had to fight. He was telling me I should have gotten to the hospital a lot earlier. Transportation issues, dog issues, caregiving. Truth be told, I was scared shitless. I still had to deal with the fear that I had. I was hearing them. I thought I had a few days or some time. And I did this well after Christmas holidays because I knew how screwed up the bus schedules were. To me, that was a legitimate excuse. And dealing with my dog is almost a legitimate excuse right there, but not enough. I should have been taking care of me more. I didn't. So, I decided I was going to have the doctor contact and we'll do a video. And then I decided, okay, I'm going over to the hospital and see what happens. This past Monday I had a therapy appointment and I talked detail about it. What the plan of attack was going to be. It was going to be Tuesday. I delayed it until Wednesday today. But I called when I saw the hole. And that's when I really had a conniption fit over it. Get my sock out. Get my foot taken care of. Welcome to the discharge papers I got. Now I know HIP is out there, but what they said was a diabetic foot infection. Local infection of the skin and subcutaneous tissue, unspecified. If I have any more problems, I have to call the emergency department. You can get over there. I still need to see a doctor. And I've already got appointments to see doctors about this thing. Wound care, I got to deal with. I had an MRI done, which should have been done last week, but it wasn't. And they said there was no evidence of acute osteomyelitis. And if they had found an infection in the bone, I'm dead. Inpatient and everything worse. The evaluation is limited by a motion artifact, whatever the hell that was. Diffuse soft tissue edema cellulitis with a soft tissue wound, or also plantar to the first MTP joint. Now, maybe at one time I understood what the hell that meant. That's something about my big toe and the area over there. But they also did a chest X-ray on me, which I didn't expect. The chest X-ray was showing that my heart was enlarged a little bit. Mild cardiomegaly. I have been not sleeping as much as I should, dealing with her. I try to get as much sleep as I can. But I'm killing myself one way or another. Killing myself one way or another. I have to go make appointments with the primary care physician. Again, we had a video appointment and got that screwed up. We tried to talk to each other in the hospital, but communications are sucky. I would have to go outside to make the communications. So, give him a call tomorrow. As for the foot, I still got podiatry coming up. Maybe they can advance the date earlier, so I can go in earlier. He gave me antibiotics. Start them out. I still need to get them over at the Kaiser. But they had transportation arranged for me going home. I got to go over to Kaiser to get the rest of the medications. And I don't want to screw that up either. I don't. It's a way to fight off the infection, and I can't afford to screw that up. My mama wants me to stay as much as I can. Going through the ER, I was scared. Going in the ambulance was scary enough anyway. Trying to talk about it, make jokes about it, but the thing is, I was totally afraid about my dog. Who's going to take care of her? You know, I'm screaming at people left and right. I need help. I need help. Somebody watching over her. And so many people who I thought might be able to help me out didn't. And somebody who reached out, he did help. I'm eternally grateful to him. He gave me the riot act. I came home. He did. And I stood there and listened. If I don't take care of my body, I ain't going to take care of her. And I think she'll be going first before me. But if we both don't go just yet, at least not tonight, that'll be a good thing. When I got over to the hospital, they put me in one of those gurneys, and I'm waiting around for a few hours. Maybe about an hour. They had blood work done, x-rays, another hour and a half, MRI, and then going over information, and then I get the notification from the doctor. I'm not inpatient, I'm going to be outpatient, discharged that night. I had to go through the insurance to get the private ride back home. And when I got home, that's when I got the riot act from that friend of mine. Yeah, he was serious about it, and I wanted him to be serious about it. He was correct in a lot of things. Was. And I'm grateful. I'm grateful. I didn't want to disturb her. I didn't want her. She's sleeping soundly in my arms. I thought I would lose her. I was thinking about her all the time. I was also trying not to stress out about how much I didn't like the medical situation at all. But I had put myself into the situation. I didn't take care of myself a long time ago. If I can give a message to myself earlier in my youth, I would tell them, I don't care how much you fear these guys. If you don't take care of yourself, it's going to be worse on you. Trust me. When I heard about the diagnosis, after 5 hours of staying in the ER, I cried. I wept in relief. I was coming back home to see her, but I was grateful that I didn't have something worse. I have to take care of myself a little bit better than what I've been doing. I didn't want to react to politics or anything else. I was just focused mostly on today. Because how I got myself in there. I could be beating myself up to death. I'm grateful that it was not as bad as it should have been. What I was afraid of is losing my dog and then staying impatient, and then having things being so damn rotten I couldn't even deal with it. I just want to spend some time with my dog, get my feet taken care of. Just put the sock on it. Find out if I got any antibiotic ointment around here, because I know I have it around here somewhere. The bandages. Find a way to get done. I know I have some cleanup in my apartment to do because of the spills happening, but not going to stress as much. But this is what's happened. I'm okay. I'm alive. I'm grateful. I'm grateful. It could have been a hell of a lot worse. It should have been a lot worse. It should have been a lot worse. It wasn't, but it could have been. I've had a lot of fear, a lot of phobias against the medical establishment. Poking, prodding, pain, everything else. I didn't want to deal with it until I needed these guys to take care of me. And it almost became too late on that one. And I have to stick around to take care of her. Somebody was asking me about what birthday present I want. I said my health. I had to be reminded about that in the ER. I'm laying in a gurney, and there's patients around me of different ages, different conditions. It was busy in the ER. It had gurneys all over the place. It had all the chambers and sections filled in corridors. I was part of the corridor. Elderly ladies dealing with worse conditions than mine. It's humbling seeing this. Hearing what was happening. One lady stayed in there for a long while. She was going to get transferred over to another facility for care. Long term. She was already having gout. I thought I had gout in my feet. I could have. Maybe I did. I didn't really realize it. But I noticed that the redness and swelling in my feet weeks ago faded. I was seeing other people who were waiting to get transported or looked after. I just sat there and listened. For hours I listened. And just watched. Nervous about my own situation, but also worried about my dog. And I had to sit and listen. Not hearing the medical staff talk, but the patients. I didn't expect myself to be a patient over there a second time over at AB Hospital. The first time was just dealing with my hand, wrist, sprained from the thumb all the way down to the elbow. And I had to have pain relievers and a brace. I was grateful that I wasn't serious enough to stay overnight. But that was a few years back. This was happening today. That I had to go to the hospital. I'm grateful I went to the hospital. I'm grateful that I dealt with the staff over there. I always hate things sticking into my arms, and it never did like the damn sticking. But here's the thing, concerning about a phlebotomist. He's a good guy. He knows how to stick you right, and you don't feel it as much. Didn't react. He's laying down and relaxed. The arm had to be stiffened because he needed to get a vein popped up. He did. Got it. One shot. Did his work in about 10-15 seconds and went on to the next patient. It wasn't a long 15 seconds. It wasn't very long at all. Maybe 5 or 10 seconds. MRI was loud as hell. Almost got deaf in the damn thing. Not because of the sound, no, because I crushed in a earplug in here. Put the wax right in the ear. 2 plugs, headset, and just hearing this machine going off for about 10-15 minutes, making weird sounds. And then I had to wait about a half an hour or an hour. I'm wondering how my dog was doing. She was worrying about me, and I worried about her. I'm grateful. And today, yes. Tomorrow, I gotta get a sock on tonight. I'll tell you one thing. When you go over to ER, you're gonna have to have your stomach empty and just deal with it and just wait for water. Because these guys don't do anything until you get some of the tests done, and then maybe you'll get a little cracker and juice. I'm okay for right now. I've gotten some water. So my body's dealing with that. Not dealing with her. I'm going to sit up for a while. That being said,